Hello, and welcome to another episode of In Just 1 Minute or So. Today we continue talking about depression and bipolar disorder. We're now going to talk about risk factors. So let's jump in. Risk factors for depression. Depression has no single cause and often involves the interaction of many biological, psychological, and social factors. A person may become depressed without any explanation. Sometimes a person becomes depressed when something very distressing has happened to them and they cannot do anything to control the situation. For instance, the breakup of a relationship or living in conflict, having a baby, the loss of a job, or difficult finding a new one actually. Having an accident, which results obviously in a long-term disability in this case, being a victim of crime, or developing a long-term physical illness. Caring also full-time for someone with a long-term disability can lead to depression. The death of someone loved, especially in childhood. Depression can also result from some medical conditions like stroke and heart disease, dementia, hypothyroidism, multiple sclerosis, lupus, Addison's disease, Parkinson's disease, cancer, and so on. The side effects of certain drugs also can cause depression. The stress of having another mental disorder such as schizophrenia, severe anxiety, or an eating disorder can cause depression. Also, premenstrual and menopausal changes in hormone levels, the lack of exposure to bright light in the winter months, and or the substance use disorder, particularly the misuse of alcohol or cocaine. Some people will develop depression in a distressing situation, while others in the same situation will not. Now, what about the risks for bipolar disorder? The causes of bipolar disorder are not fully understood. However, there are certain factors involved. For instance, genetic factors. That is, although bipolar disorder is not directly inherited, people who have a parent who is affected or a family history have higher rates of this disorder compared to the general population. Also, biochemical factors like mania and depression are believed to be associated with an imbalance in the brain, the chemical imbalance. Also, stress may play a part in triggering symptoms in vulnerable people. And finally, medications. Episodes of mania may occur after an illness, the use of drugs, and taking certain medications used in the treatment of physical illness. Alright, that's all for this week. Thank you so much and have a good one.